tragedy on a day when 25 people have died at the Jaipur Golden Hospital in the national capital due to a shortage of medical oxygen. Prime Minister Narendra Modi has chaired a meeting to discuss ways to boost the battle against the pandemic, and the centre has waived off basic customs duty, a health cess on oxygen, on COVID-19 vaccines, as India is battling a second wave of the COVID-19 pandemic, with the situation becoming grimmer by the day. The Prime Minister reiterated the need for all ministries and departments to work in synergy to increase the availability of oxygen and medical supplies. Let's go across to Sunil Prabhu, who's monitoring this story. Sunil, I'm looking at the Minister Piyush Goyal's tweet where he says, "Thank you, Modi ji, for providing relief by waiving off customs duty and health cess on oxygen and related equipment, and that COVID-related vaccines are now exempt from customs duty." He says this will boost availability as well as make these items cheaper. Sunil, I'm sure the families of those 25 patients who died this morning at the Jaipur hospital because there was no oxygen would have been wondering why this is happening now.
Absolutely. Sarah, you couldn't be more right. And it's sad that even at this stage, we are trying to give a spin to a story. Yes, it's a human tragedy. It's extremely unfortunate, as I would say, better late than never. But finally, good sense has prevailed. The Prime Minister, this is probably the fifth, if not the sixth meeting in the last week, taking stock of the oxygen supply. Finally, good sense has prevailed upon them that they understand something that the opposition and various states have been demanding. Remove those, customs duties, remove these basic things for vaccines so that you are able to help and ensure that this entire country gets not only oxygen, but the vaccine. If India has to succeed in this battle, it needs to be ensure that everybody gets vaccinated. And I think the Prime Minister has finally decided, with the Finance Minister present, with the Revenue Department present, and a team of officials, they have finally made a nodal person to ensure that there's seamless and there's no stoppages across India's borders at various checkpoints. That anybody who's importing oxygen or for that matter vaccine, anything related to COVID, it will get a one-stop shop and clearance immediately. So finally, I think people are beginning to act, even though it's, as I said, a little bit late. There are over 3.46 lakh cases, and it's in that context that the situation has really gone out of hand. And as you've seen, successive high courts across this country have been cautioning and questioning state governments and central governments about what exactly it has been done. As you're well aware, India and these stories are well known. No less than the Parliamentary Standing Committee on Health had cautioned, had warned this government about the fact that there would be need for medical oxygen. And if those steps have not been taken note of, clearly somebody needs to be held responsible. Right now, we are facing a national health emergency, so we won't get into that. But definitely, as you said, for those 25 people who lost their lives, along with hundreds of others, it cannot be just one blip. Somebody must be held responsible for why did we allow this export to take place? Why didn't we take adequate steps? And what is the situation today? And why have you come to such a stage where we are now sending and trying to send a story, we will win. We are sending our Air Force to various countries to import. But clearly, these are steps that could have been taken in advance, and we should not have been the biggest producer of oxygen, importing medical oxygen at this stage.
A tragic irony there. Sunil, we are fighting this battle against this virus on two fronts now. On one hand, we have to try and save lives every day of those who have been infected, those who are in hospitals, those who are struggling for medicines, who are struggling for beds, who are struggling from oxygen. And on the other hand, it is a race against time to vaccinate as many Indians as possible to prevent them from catching the virus, or if they catch it, make sure they catch a weak dose of the virus. So what was decided in this meeting today, in this high-level meeting, when it comes to being prepared for this next phase in our nationwide vaccination drive, which is opening up on the 1st to everybody? And I mean, I can tell you, I am going to be there ready wanting to take my vaccine. Is the government going to be prepared? Are the systems going to be in place? Was that discussed?
Yes, it was discussed. You will definitely be able to register after the 28th. The CoWIN app is the system where you will have to register, and that will be the way to go forward. They want to do it in a mission mode. Both the chairman of the CoWIN, Mr. R.S. Sharma, as well as the health secretary were briefing states about how they need to go about it. They want them to do it in a mission mode format, get everybody involved, from private hospitals to state governments to industrial houses, to use whatever possible facility they have. Everybody, as you rightly said, needs to get vaccinated. And it's in that context that every struggle has to be made to ensure that they succeed. People need to get onto the CoWIN app. They need to get and facilitate that. Correct data is required so that the system doesn't collapse. That key material that is required has been pointed out by the CoWIN chairman. And then, of course, to ensure that since this is a pandemic situation, that there are enough hospital beds, there are field hospitals, and there are various other systems that have developed. So all in all, I think every effort is being made to, augment this. You have seen the story that has come about the various prices. Serum Institute has tried to play it down by saying and explaining why they have given 600 rupees a vaccine. They're waiting for the import of other vaccines that are coming. For example, Sputnik, which is waiting with the doctors ready to come into India. But in that context, we'll have to wait and watch how things unfold. But definitely at this given juncture, every effort is being made that you, along with the rest of this country, succeed in getting the vaccination.